let's talk about some very down-to-earth and practical issues related to social distancing. Hi, I'm Dr. John Waits, a family physician that delivers babies, leads a residency training program, and together with Dr. Lacey Smith, we co-lead a network of community health center clinics across central Alabama. As we all now know, COVID-19 is the disease caused by the novel coronavirus, SARS-CoV-2, introduced to humans for the first time in Wuhan, China, back in November of 2019. According to the World Health Organization and the Centers for Disease Control, the coronavirus is spread from person to person through respiratory droplets. That's when a person coughs or sneezes, for example. These droplets can land in the eyes, nose, or mouth of a person in close proximity. These droplets, they're too heavy to travel far in the air. They only travel about 1 meter, just over 3 feet, and they fall to the ground or settle to the nearest surface. So the exact time that the SARS-CoV-2 coronavirus that causes COVID-19 can live on surfaces is not yet known, but we estimate that this is up to 3 days on some surfaces. Thankfully, it seems to be less than a day on cardboard boxes. Frequent cleaning with appropriate CDC-recommended and EPA-approved cleaners such as Santa wipes or alcohol-based cleaners of greater than 60% alcohol, or appropriately stored hydrogen peroxide, or vigorous soap and water. These things are essential during an outbreak for any respiratory illness, but especially now. Our hands, they touch a variety of surfaces throughout the day. These surfaces can be contaminated with the virus. This is why you should avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. Legitimately, this is much more important for the average person than just wearing a mask, which might not be the correct type or might be taken on or off with non-sterile hands, and which is not going to protect you anyway. When you cough or you sneeze, don't cover your mouth with your hands. Instead, cover your mouth with the bend in your elbow or disposable tissue. You need to dispose of this tissue immediately in a closed trash can, and then please wash your hands. Speaking of hand washing, this is truly the most effective way to prevent the spread of this new coronavirus. In addition to avoiding touching your face, eyes, nose, or mouth, you need to wash your hands frequently with soap and water. You need to make sure you use enough soap for the front and back of your hands, washing for 20 seconds, covering all surfaces of your hands, and then paying careful attention to what you touch next, such as the faucet or the bathroom doorknob. If soap and water are not available, make sure that your instant hand sanitizer contains at least 60% alcohol and it covers all surfaces of your hands. And in this case, it needs to be allowed to air dry. The Centers for Disease Control and the World Health Organization are not recommending widespread use of masks for the general public, but instead, they recommend what I've been highlighting in this video. If, however, you do find yourself using a mask, for example, in a very crowded area, please pay careful attention to how you put the mask on and off. Don't ever touch the front of your mask, and any touching behind the mask or touching your face defeats the purpose of even wearing the mask. Also, wearing a mask in situations where it's not recommended can create a false sense of security because it might lead to neglecting fundamental hygiene measures, such as proper hand hygiene. If your family member gets diagnosed with COVID-19, they should wear a mask at all times, as this will keep their own respiratory droplets inside their own mask. So we wanted to point out these points of practical social distancing. At Cahaba Medical Care, we are a community health system around central Alabama. We're here for the distance. We're here for you during the COVID-19 challenge, but we're also here for many other chronic disease processes, prevention. We are called to our communities. We currently have 16 sites in Bibb, Perry, Chilton, and Jefferson counties with over 60 healthcare providers. And we have a COVID-19 hotline. If you have questions or feel like you need to get tested, you can call us at this number for more information.